today.
Hi everyone,
how's your
and
day been
welcome to
going?
Mental
What's
Health
going on
Task
for you?
Sharing.
Really
Module
pay
4,
attention to
Section
that
3,
because
screening
that
and
clinical
assessment
judgment
of
that you're
depression
going
and
to
anxiety.
build will start.
This is part of our
right?
broader
You may notice the
Module
person
4
seems really
community care
jittery and
model.
anxious. The
And the
person
goal
seems
of
kind
this
of
section is to
withdrawn and
provide
shy.
you with the
You
background
can learn
information
all about
how
their
to
presentation
speak to people
and what's going
while
on for
you're
them
screening.
from the moment
we'll
that
be
you start
reviewing some of the
interacting with
forms
them.
that you'll
don't need
use
to
as
wait
we
to
go through
ask
this section.
questions.
I'm Marina
to begin
Weiss,
to
a clinical
understand a little bit
psychologist and
about where they're
postdoctoral
coming
fellow
from.
at the Center for Innovation in Mental Health
Before you get
at the
started
CUNY
on
Graduate
screening,
School
you
of
also
Public
wanna
Health and Health Policy.
explain
I'm really
the
excited
purpose
to
of
talk to you
screening.
more about getting
We'll
this
talk
project
about what that
off the
looks like,
ground.
but you
So
can think right
let's
now
get
if you
into
already
screening.
do this.
Today we'll be talking
how
about
you would explain
why
what
mental health
screening
screening
is
is
for,
important,
and how you explain
the common
confidentiality,
mental health
right?
challenges
Because
that we
often folks
encounter
are
with
not that
screening,
comfortable jumping
and
into an
strategies
explanation
for screening and
of all of their
assessment, how we
medical
can
history.
engage
So why would they want
consumers
to tell
make
us
them
all their
feel
mental health
comfortable
history
and feel like opening up
unless
to us,
we explain
as
what
well
we're
as the
going to do
tools
with
that
that
we'll use
information
and the
and how
practice
that
that
we're going to protect their
administering one
privacy.
of the forms that we may use.
Additionally,
the
and
PhD
finally, we want to make sure
So
that we're
why is
being
screening
with
important?
the consumer.
What do you
so
think?
if they share anything that's
Here are
difficult,
just
we
some
want to
of the
validate
reasons
that.
that we
If
think
they share
screening
things
is
that are
important.
successful and
The
really
first is that
exciting to them, we
20%
want to validate that.
of
right?
adults
if
are
they have concerns,
experiencing
we
a
want to
mental health
normalize
condition
and reassure
right
them
now
and
in
make
the
sure that
United
we're
States.
staying
So
with
we
whatever
know
emotion
that
they have,
mental health
so
concerns
that they
are
feel
really
supported
common.
and secure.
Additionally,
So let's talk
stress,
a little bit
like
more
poverty
about
and
discrimination-related
like.
stress has been shown to worsen
We're going to
mental
be
health
using
problems.
several
So
tools for
communities that
identifying
are
mental
lower
health
income
concerns.
and that are
We're going to be
experiencing
using
oppression
both
like
the
racism,
PhD4
homophobia,
at screening
transphobia
and the
are more
PhD9
likely
further
to
into
experience
counseling
worse mental
to
health
help
days.
support folks around
Additionally,
experiences of
folks who
depression
are
and
low
anxiety.
income in New York
Today we'll
are
also
more
be
likely
talking
to
about the
lack
substance
access
use
to
disorder
mental health
risk form,
services,
which is
until
a risk
they're in a
assessment form
crisis.
Part
And
A.
then when they do receive those services, they're receiving a
So
criminalized
let's talk a
police
little bit more
response
about the
instead of a
PhD4.
caring and compassionate response, the
The
way that we would
PhD4
respond to
looks
a
like
physical
this.
health problem.
You
You
may
may
already
already
be
be
familiar
familiar
with
with
it.
it.
It's
It's
called
with
the
our
4
dentist
because it has
appointments
4
until they were
questions.
crisis level
You
problem
ask
and
the
then treated
question
them
at
with
the top.
police.
How often
Because
have
people
you been
were really
bothered
out
by
of
each
control
of the
because they were in so
following
much pain.
experiences
That
during
would
the
also
past 2
probably
weeks?
not work very
And then
well.
you
And
ask
our
about
current mental
each
health care
experience
system
and read
lacks
the
the
answer options
capacity
because
to
it is-
respond to all the New Yorkers
it
who
is
have
the
more
case
mild
that
or
many
moderate
people
symptoms, and that's where
are
mental
going
health
to
task sharing comes
say
in.
something that's
Mental
a
health
little bit
screening
different from the
is an
answer
important
options,
part,
right?
right?
Mental
So
health task
we'll talk a
sharing
little bit
that
more
helps
about
us
this when we get to an
identify
example.
who
But if
might
you say
need additional
how often have you
support
been
and be
bothered
at
by
risk
each of the
for
following
developing a more
experiences during the
severe
past 2
mental health
weeks?
concern?
Feeling
And
nervous,
helping
anxious,
us
or
identify
identify
those
the
folks
person
and
might
connect
say,
them to
I don't know,
services
I guess I felt a
before they
little
get to a
nervous on
crisis
Tuesday.
level is what we're all about.
That's giving you something
that
that's
increased
a little
access
bit
to
more than
services
not at
can
all,
help
but we don't
increase
have that
folks'
capacity
down.
to cope.
So
we'd
and
say,
build
okay, was it
resilience
just
over
Tuesday?
time.
As a
Or
reminder, would you say
consumer
it's
journey starts
several
with community
days or more
outreach.
than
Our
half the
second
days
step
or nearly
is
every day
screening.
that you
So
feel that
we'll
way.
begin to learn
Right, so
more
you
about
can just
that.
we want to start first by talking about some common mental health challenges, which we already reviewed in Module 1. What kinds of mental health challenges do you think are most common? If you said anxiety and depression and substance use, those are correct. So let's get into those. A lot of folks, when they're experiencing depression, experience these kinds of symptoms. We may think of depression as primarily being about sadness, but it can also be about sleeping too much or too little, having trouble concentrating or making decisions, no longer feeling interest or pleasure in the things that you used to like, feeling really irritable and angry and taking your anger out on other people, maybe even other people you don't know or very well, and feeling increased or decreased appetite, resulting in changes in your weight, as well as feeling tired and fatigued all the time, even if you're getting enough sleep, feeling that you have a lot of restless energy in your body or that your body is moving really slowly, and feeling worthlessness or guilt. At its most extreme, when it's not treated at all, major depressive disorder can result in feeling that you want to end your life or that life is not worth living, which can lead to thoughts or plans of suicide. And similarly, we know that anxiety and depression can overlap a lot, but there are specific components of anxiety disorders that can be important to keep in mind. Some people have social anxiety, which is fear about social interactions, either fear of being observed or evaluated by others, or just feeling generally very self-conscious in different kinds of social situations. Others have what's called generalized anxiety disorder, which consists of constantly worrying about lots of different things that could go wrong, or maybe that you didn't lock your apartment, things like that. Obsessive compulsive disorder is the more extreme version of generalized anxiety disorder, where there's intrusive and unwanted thoughts, images, or urges that cause significant distress. So if somebody's worrying that they didn't lock their apartment, even if they know that they did lock their apartment, they might need to go back and check several times. And those actions of going back and compulsively checking, that's how we distinguish compulsive behavior. And that addition makes that OCD. We don't need to learn these diagnoses for mental health task sharing, but it can be helpful to know a little bit about them and know that they all fall within the category of anxiety disorders. There are 2 more anxiety disorders that we just want to mention so that they can kind of be on your radar. But again, we are not going to be diagnosing consumers because our purpose here is just to understand whether somebody has a level of severity where they need to be seen by a licensed professional or whether we can provide them some support along the way. An additional anxiety disorder is panic disorder. This is characterized by a sudden rush of intense fear with an intense physical reaction, such as feeling that your heart is racing and you're profusely sweating. Often folks with panic disorder do feel like they're about to die when they have these kinds of panic attacks. And fortunately, these are really easily treated in therapy. So these are a great thing to refer people to a licensed professional for. If you're seeing symptoms like panic attacks, they can get that taken care of. And then finally, phobia disorder. So these are fears about specific factors or situations like fear of heights, fear of spiders, fear of blood. These kinds of fears are very specific and they may or may not interfere with a person's life. If the person has a fear of spiders but doesn't live in a place with spiders, maybe that's not a big problem for them. But if they have a fear of crowded places and they want to be a comedian, maybe that's something that they need to work on with a licensed professional so that they can do some stand-up. Right? So for different people in different ways, these anxiety disorders can show up and be more or less difficult for them to manage. But it's good for us to just kind of know a little bit about what anxiety can look like and that it can have lots of different presentations, just like depression. Let's also talk a little bit about substance misuse and use disorders. We believe that substance use disorders are characterized by being unable to stop or control your use of a specific substance like drugs or alcohol. Additionally, noticing that the direct or indirect effects of using the substance are negatively impacting your social, professional, or other important aspects of your life. Like they're preventing you from getting to work on time, you're not getting promoted because you've been late so much. Or they're preventing you from keeping your relationship with your neighbor because you're so inconsiderate and you're so irritable when you're drunk that you've been quite rude to that person several times and now they don't like you, right? These kinds of negative impacts on our lives start to indicate that this person may have a substance use disorder and they're not able to control the ways in which their behavior is impairing their capacity. We believe that substance use disorders are often a way of coping, right? Not a great way of coping, but a desire to use the substance to manage or avoid our negative emotions, right? Instead of developing a wider array of coping strategies and recognizing, hey, I'm really distressed right now, rather than taking this out on my neighbor, I am going to manage these feelings myself with mindfulness or manage these feelings myself with a wellness skill like exercise, right? Using alcohol or drugs to manage those negative feelings is not an effective strategy because those negative feelings are still with us when the drugs or alcohol have gone away. So we want to make sure that consumers have a wide array of coping skills and we can offer them some of those, but if they're really having a substance use disorder, that is cause for us to refer them to a licensed mental health professional because we are not actually going to be able to teach them how to overcome a substance use disorder in the short interventions that we will be offering. We want to make sure that folks are aware that even though alcohol use disorder and other substance use disorders may seem really harmless for some folks, they're really important to take seriously because they often do have many adverse effects, including brain damage and permanent personality changes and coma and or death, right? So we want to take really seriously that if somebody is really relying on a substance to cope, if that substance is as dangerous as alcohol or as dangerous as heroin, those kinds of substances can really lead to a greater likelihood of death. So we want to take that seriously and make sure that they get the care that they need. So let's switch gears a little bit and talk about strategies for screening. You may already be screening folks in your line of work, and if you are, that's great. Let me know if you have additional feedback about things that we can include here. If you are new to this, please know that this is for you, and we're also really interested in your feedback and any questions you may have about this. So when we're screening a consumer, we want to start by building a relationship to increase their comfort. Just like you would in any other human interaction, you want to start by introducing yourself and asking about them. Then you want to ask if they have questions and invite small talk. So you're like, hey, I'm Marina, how you doing? What's going on? And I'd love to get into some of the screening things that we have to talk about today, but how's your day been going? What's going on for you? Really pay attention to them, because that clinical judgment that you're going to build will start then, right? You may notice the person seems really jittery and anxious. The person seems kind of withdrawn and shy. You can learn all about their presentation and what's going on for them from the moment that you start interacting with them. Before you get started on screening, you also want to explain the purpose of screening. We'll talk about what that looks like, but you can think right now, if you already do this, how you would explain what screening is for and how you explain confidentiality, right? Because often folks are not that comfortable jumping into an explanation of all of their medical history. So why would they want to tell us all their mental health history unless we explain what we're going to do with that information and how that we're going to protect their privacy. Finally, we want to make sure that we're being with the consumer. So if they share anything that's difficult, we want to validate that. If they share things that are successful and really exciting to them, we want to validate that, right? If they have concerns, we want to normalize and reassure them and make sure that we're staying with whatever emotion they have so that they feel supported and secure. So let's talk a little bit more about what that looks like. We're going to be using several tools for identifying mental health concerns. We're going to be using both the PHQ-4 at screening and the PHQ-9 further into counseling to help support folks around experiences of depression and anxiety. Today, we'll also be talking about the substance use disorder risk form, which is our risk assessment form part A. So let's talk a little bit more about the PHQ-4. So let's talk a little bit about using the PHQ-9 for screening for depression and anxiety. When we're asking questions with the PHQ-9, we ask, how often have you been bothered by each of the following experiences during the past 2 weeks? Then you want to read each experience and also the answer options. Folks are not going to remember those. And just as you would with any other screening tool, you want to ask follow-up questions if they give an answer that's a little bit different from those answer options. So if you say, how often have you been bothered by having little interest or pleasure in doing things in the last 2 weeks? And they say, well, I'm not sure, I guess a couple days. We want to follow up and say, okay, so that sounds like they're not saying it's not at all, and they're not saying it's nearly every day. We might say something like, would you say it's more like several days or more like half the days? And if they say, would you say it's more like several days or more than half the days? And then they might say, oh, actually, I think it's more than half the days. Asking those follow-up questions is really the best way to make sure that we're really accurately asking these questions. Folks are much more likely to be real with us and open up to us when we're being with them and responding each time. So if someone did say, oh, I guess I've had little interest or pleasure in doing things for more than half the days last week, we want to respond to that in a compassionate way. And you can do that in your own style. That might say like, oh, that sucks. I'm sorry that's happening to you. Or it might sound something like, oh, that sounds really hard. How long has that been going on? Was that more than the last 2 weeks? Following up with some comments and questions when they share their emotional difficulty can really help them start to feel heard and seen. And that's the first step to feeling better, right? Self-awareness, self-acknowledgement, and social support. So let's keep going. Let's look at some additional questions here on the PHQ-9. So the PHQ-9 asks a lot of questions about experiences that are related to depression, but they may be related to anxiety as well. What's most important to notice here is that at the end, we have this question, thoughts that you would be better off dead or of hurting yourself. If people are having those thoughts and they say, well, I'm having them all the time, but I would never act on them because I love my kids or because my religion doesn't allow suicide or self-harm, we still want to take that seriously, because when folks are telling us that they have a positive response to this question 9 on the PHQ-9, what they're telling us is they're in severe emotional distress. So it doesn't really matter if the rest of their scores are pretty low. If they have said they are having these kinds of thoughts, we want to make sure that we elevate them to a referral to a licensed mental health professional. And that's because we want to make sure that they get the care that they need to manage their experience so it doesn't rise to a crisis level. So let's take a moment and just review the scoring for the PHQ-9. If folks score 0 to 4, we call that a non-significant score on the PHQ-9. That means that they don't have significant depressive symptoms. 5 to 9 is mild, 10 to 14 is moderate. 15 and up, we're going to say they have a more significant disorder. The PHQ-4 looks like this. You may already be familiar with it. It's called the 4 because it has 4 questions. You ask the question at the top, how often have you been bothered by each of the following experiences during the past 2 weeks? And then you ask about each experience and read the answer option. Many people are going to say something that's a little bit different from the answer options, right? So we'll talk a little bit more about this when we get to an example, but if you say, how often have you been bothered by each of the following experiences during the past 2 weeks? Feeling nervous, anxious, or on edge, the person might say, I don't know, I guess I felt a little nervous on Tuesday. That's giving you something that's a little bit more than not at all, but we don't have that precise down. So we'd say, okay, was it just Tuesday, or would you say it's several days, or more than half the days, or nearly every day that you feel that way, right? So you can just give them the additional answer options that seem to fit with what you're asking. If they give you a chance to give all the answer options to start, that's great. And if they choose one of the answer options, that's great. But we want to make sure that if they answer vaguely, we're following up and asking clarifying questions so we can better understand what they really mean. Scoring. Overall scores can indicate how severe the person's emotional distress is. So if they are scoring 0 to 2, that means they don't have significant emotional distress. If they have a 3 to 5, that means they have mild emotional distress. And if they have a 6 to 8, that's moderate, and a 9 to 12, that's severe. So if somebody is coping with a really high level of emotional distress, that's probably a sign that they would benefit from referral to a licensed mental health professional. And we'll get more into that as we talk more about risk assessment later in this module. But this is just something to keep in mind. All of the mental health concerns that we are going to be identifying are treatable. And so if folks are showing up and demonstrating that they have this level of concern, we want to make sure that they get the help they need. So let's talk a little bit about scoring. When you're scoring the PHQ-4, you can have 3 different scores. The first score is the sum of the first 2 items. Items 1 and 2 are an anxiety score. If the total score of items 1 and 2 is 3 or more, that indicates that person has potentially been struggling with anxiety in the last 2 weeks. Similarly, you can sum the bottom 2 items, items 3 and 4, and if that score is 3 or more, that indicates the person is struggling with depression. So in addition to the overall score, we have these helpful clues about which direction the person's distress is most likely going in. Is it more of an anxiety flavor or more of a depression flavor? Let's talk a little bit about assessing substance misuse. In mental health task sharing, we use this form to assess substance misuse. We ask about the last 6 months and how many days they had any alcohol or used any marijuana or used any other drugs to get high, like pills, prescriptions, or over-the-counter medications, or other things that you might sniff, huff, vape, or inject. If they say no to all of those questions, we can skip ahead. Either they're not going to tell us, or they're not actually using any drugs or alcohol. If they are using drugs or alcohol, we want to understand if it's more of a substance use or substance misuse situation, or if they're using those things responsibly. And here are the 4 questions we'll ask to follow up to understand a little bit more about their use and how healthy it is for them. We first want to ask if they're using drugs or alcohol when they're alone. Then we'll ask if they ever forget things that they did while using alcohol or drugs. And then we'll ask if their close family or friends ever told them that they should cut back on drinking or drug use. Finally, we'll ask if they've ever gotten in trouble when they were using alcohol or drugs. And if they answer yes to 2 or more of these questions, that's a sign that they may have a problem with substance misuse or substance use disorder. And if that's the case, we really want to be thinking about how we can connect them to support, because that's a sign that they need additional coping skills beyond their substance to manage their emotions, which they are probably managing mostly with that. And it's important to note here that substance use is often really stigmatized. So folks who use substances may feel a lot of shame and guilt about that, and it may be harder for them to reach out and ask for support around these kinds of experiences when they think that this is the main way that they feel better. So we can't force folks to get treatment before they're ready. And if we do try to force them to do anything they're not ready to do, they're more likely to resist our support. When we're asking these kinds of questions, we want to be with as much as possible. And when we're offering referrals for substance use, we also want to say to folks, I'm concerned about your stress. I want to make sure that you get the support that you need to be as successful as you can. Have you considered having this kind of support, and how do you feel about that idea? We don't want to rush them into things, and it's okay for them to take a week or 2 to think about what makes sense for them. We also can provide the mental health task sharing stress reduction skills and help them build a bigger vocabulary of coping skills in the hopes that that will help them manage these stressors that they're experiencing better. And if that works out for them and it helps them reduce their substance use, that's great. But if they are continuing to use substances in these kinds of ways, we might want to think about suggesting that again, or talking to our coach about how we can talk to them further about it. And substance use is one of those things that folks generally have a lot of resistance to changing. So that's also one of the reasons that a referral to a licensed mental health professional can be really helpful here. So let's briefly review the other tools that we use in mental health task sharing to support screening. In screening for depression, when we're actually doing counseling with folks, we'll use the PHQ-9. And in screening for anxiety, when we're doing counseling with folks who have more of an anxiety flavor, we will use the GAD-7. And these 2 measures are mostly used to assess the progress that folks are making in managing their symptoms when we're doing that counseling piece. So let's get into a little bit of practice with screening. Let's say Kiara, a 27-year-old Black woman, has come to your organization and you'll be screening her as part of your intake. Pause the video and make some notes. What key points do you want to cover before you get started in screening with Kiara? Here's our suggestion of the things that you might want to cover, and you don't have to do them in this order, but you want to cover most of these things. You want to introduce yourself, right? She's going to feel a lot more comfortable if you've made it clear who you are and what the scope of your role is, what you're going to do together, which means explaining the purpose of screening and also explaining the confidentiality which is in place at your site, right? Which might be something like, I can keep all of the things that you say to me totally private unless there's some kind of major danger to you or someone else. Then you want to be with Kiara using ORs. That's our open-ended questions, affirmations, reflections, and summary. How are you going to show her that you're really listening and that you're really trying to understand where she's coming from? That kind of thing can make her feel a lot more supported and comfortable with you. And then finally, if she does share any concerns, you want to validate, reassure, and normalize those feelings and concerns that she's trusting you with. So let's think about those 5 steps and how we could bring them into a couple of sentences that we can say to Kiara. One example is we can say something like, "Hi, I'm Alicia," introducing yourself. "I'd love to ask you some questions so that we can better understand how to meet your needs." Explaining the purpose of screening. Then you want to explain confidentiality, which might look like, all of your answers will be kept confidential unless someone is in danger. Then you want to ask if she has any questions. Do you have any questions before we get started? Whatever she says, you want to respond compassionately, and that's the being with piece. So essentially these 5 pieces are actually something that you will want to bring into any early interaction with a consumer, because screening is generally the first step of really bringing somebody into care, we want to make sure that we cover all these pieces. If you have any questions about this, please let us know in the knowledge check that follows. So let's pretend that you've actually engaged Kiara, you've introduced yourself, you've reassured her about her concerns, and she's comfortable with screening, and then it's actually time to do the screening. So as you listen to the following role play, make a note of how you would score Kiara on each of the items on the PHQ-4 shown here. So if you said to her, how often have you been bothered by each of the following experiences during the past 2 weeks? Feeling anxious, nervous, or on edge? Maybe she says, yeah, I guess I've been feeling nervous, anxious, and on edge, but I'm not sure if it's more than half the days or every day. You might say, when was the last time you felt nervous, anxious, or on edge? And she'd say, I guess 3 days ago, yeah, I was feeling pretty anxious. So, okay, so you felt pretty anxious 3 days ago, which was Monday. Have you felt pretty anxious any of the other days in the past 2 weeks? Since like August 3rd? What's been going on for you? Well, not really. Last Tuesday, I had to have a job interview and I felt so jittery in the days before the interview. The night before, I had stomach cramps and I couldn't fall asleep. I felt super out of it during the interview and felt like I was thinking slowly. Like, this might sound crazy, but like I was underwater or something, and I just kept worrying about it. It sounds like you felt pretty anxious about the interview. Yeah, I guess. Have there been other times over the past 2 weeks, since August 3rd or so, when you felt pretty anxious or jittery or had trouble falling asleep or stomach cramps? No, not really. So what answer would you choose for Kiara? If you chose several days, that's correct. Even though she initially was overextending that and saying that it might be nearly every day, when she actually described her experience, not at all is obviously not appropriate, and she mentioned 2 occasions over the past 2 weeks when she felt anxious and experienced physical symptoms associated with anxiety, like stomach aches and headaches, right? And as you know, no assessment is perfect, and this is something that you'll learn over time, but in some cases, learning a little bit more about the duration and severity of symptoms may take a little bit of exploring and following up with clarifying questions, as in this example. Okay, so let's try the next one. Over the past 2 weeks, how often have you been bothered by not being able to stop or control worrying? I guess not at all. Well, you mentioned that last week before your job interview, you were really having a lot of worries and had difficulties falling asleep. What kinds of worries were going through your head about the interview? I guess I was thinking, I don't want to embarrass myself, but I don't know if I'm qualified for the job at all. So how frequently were those thoughts coming into your head? All the time, I guess, especially on the 3 days right before the interview. So what answer would you give for Kiara's response? If you chose several days, that is correct, because she was unable to control her worrying about the interview for 3 days. But it's also important to know that this kind of screening comes with practice, and with increased comfort with you and with talking about her feelings, Kiara may be more able to explain what's going on for her, and her answers may change. So this is the reading that we get right now. Whatever she tells us, whatever we understand, is okay. We just want to do our best to understand exactly what she's trying to tell us. And it may be the case, as with Kiara, that consumers might not appear to score very high on these screeners because they're not really connecting their experiences to the questions. If they correct themselves and suggest that they have these experiences, believe them. So let's take a moment to score Kiara in terms of her anxiety. If she's got a 1 for several days for the first item and a 1 for not being able to stop or control worrying for the second item, her total anxiety score is 2. If we ask her if she's feeling down, depressed, or hopeless, she might say that she's feeling that way more than half the days, then she didn't get the job. And if we ask if she has little pleasure or interest in doing things, she might say more than half the days, and we would put that down as well. So that would make her overall depression score for those second 2 items a 4, And her combined score or total score would then be a 6. So if we go back to our PHQ for scoring severity chart, we can learn that Kiara's score of a 6 puts her at moderate emotional distress. This means she might be somebody who would benefit from our counseling, but if she's somebody who actually continues to feel distressed through our counseling or gets worse, we want to make sure to refer her to a licensed mental health professional for longer term care. So let's briefly recap what we've covered today about screening for anxiety and depression. You can pause this slide and read the summary if you would like more information about what we've covered today. And here are some of the key terms that we've used. Thank you so much. We look forward to your feedback about this training on the knowledge check that follows.